If you have high blood pressure and you've ever felt nervous about flying, this video is for you. Maybe you've asked yourself, is it safe for me to fly? Can the cabin pressure affect my heart? What if something happens in the air? Stay with me, because by the end of this video, you clearly understand what really happens to your body when you fly with high blood pressure. What's safe, what's risky, and how to fly confidently and calmly without fear. Welcome to Health Aviation, where we explain aviation health in simple and clear language. I am an aviation medical schooling officer, and today we are talking about flying with high blood pressure. Let's start with something important. High blood pressure is very common. Millions of people fly every day with it. Pilots, cabin crew, business travelers, parents, grandparents, etc. So the real question is not, can people with high blood pressure fly? The real question is, how do you fly safely with high blood pressure? So let's break it down. First, what exactly is high blood pressure? High blood pressure, also called hypertension, means the force of blood pushing against your blood vessels is higher than normal. Most people feel nothing at all, no pain, no warning signs. That's why it is often called the silent condition. But even when you feel fine, high blood pressure can put extra stress on your heart, brain, and blood vessels, especially during physical or emotional stress. And yes, flying is a form of stress on the body. Now, let's talk about what really happens to your body when you fly. Inside an airplane, the cabin is pressurized, but not to sea level. The cabin pressure is usually similar to being at about 6,000 to 8,000 feet above sea level. So, at that altitude, oxygen levels are slightly lower. Your heart may work a little harder. Your blood vessels can react differently. For most healthy people, this is not a problem. But if you have poorly controlled high blood pressure, your body may react more strongly. You may notice headaches, dizziness, shortness of breath, chest discomfort, anxiety, or palpitations. So this doesn't mean flying is dangerous for everyone with high blood pressure. It means preparation matters. Now, let me answer the big question directly. Is it safe to fly with high blood pressure? Yes, for most people, it is safe to fly if your blood pressure is controlled and stable. Aviation medical guidelines generally agree on this. However, flying may not be safe if your blood pressure is very high and uncontrolled. You recently had a stroke or heart attack. You have severe heart complications. You stop your medication suddenly. That is why medical clearance matters for all passengers. So, if your blood pressure readings are consistently high, especially above 180, over 110, you should not ignore it before a flight. So now let's talk about something many people don't realize. Stress and anxiety before flying can raise your blood pressure more than the flight itself. Fear of flying, airport rush, security checks, delays, tight schedules, all this can cause your blood pressure to spike even before you board the plane. That is why how you prepare mentally is just as important as your medication. So let's move into how to fly safely with high blood pressure. First, never skip your medication. This is extremely important. Some people skip medications because they fear side effects. They want to sleep through the flight. They think one missed dose won't affect. But skipping medication can cause a sudden rise in blood pressure, especially during travel. So always take your medication as prescribed. Carry it in your hand luggage, not check baggage. If your flight is long or crosses time zones, talk to your doctor about when to take your doses. So, second, stay hydrated. Cabin air is very dry. Dehydration can thicken your blood, increase heart strain, raise blood pressure. Drink water regularly during the flight. Limit alcohol, excess caffeine, because both can raise blood pressure and cause dehydration. Third, move your body gently. Sitting still for long hours is not good for circulation. So during the flight, wiggle your feet, rotate your ankles, stand up and walk when allowed, because this helps blood flow and reduce stress on your heart. Fourth, watch what you eat before and during the flight. Salty foods can increase blood pressure. Airport food and airline meals often contain high sodium. Choose lighter meals when possible. If you are flying long hauls, eat small portions. Fifth, manage anxiety intentionally. This is a big one. Anxiety can cause temporary spikes in blood pressure that feels scary but are often harmless. So try slowly breathing, listen to calming music, watching something relaxing, closing your eyes and focusing on slow breath, because a calm mind supports a calm heart. Now let's talk about warning signs. During or after a flight, seek medical help immediately if you experience severe chest pain, sudden shortness of breath, fainting, severe headache, vision problems, weakness on one side of the body, because these are not normal travel symptoms and should never be ignored. Now, here is something many people ask. Should you check your blood pressure before flying? Yes, if possible. If possible, check it a few days before travel, the morning of your flight. If your numbers are unusually high, speak with a healthcare provider before boarding. Do not rely on "I feel fine" alone. High blood pressure often feels normal until it isn't. Now let's also talk about long flights. On long haul flights, your body experiences longer sitting time, greater dehydration, more fatigue. If you have high blood pressure, plan ahead. Choose an aisle seat if possible. Set reminders to move. Drink water regularly. Avoid excess alcohol. Small habits make a big difference. Now, let me address a common fear. Can flying cause a heart attack or stroke in people with high blood pressure? Flying itself does not cause heart attacks or strokes. However, poorly controlled high blood pressure combined with stress, dehydration, and immobility can increase risk. That's why preparation is protection. Most in-flight medical events happen because people ignore warning signs before travel. Now, here's the reassuring truth. Many pilots, cabin crew, doctors, business executives, and older adults fly every week with high blood pressure safely. But the key difference, they manage it. They don't panic. They don't ignore it. They prepare, and you too can. So before we wrap up, here is a simple pre-flight checklist for anyone with high blood pressure. Take your medication as prescribed. Carry medication in hand luggage. Drink water. Avoid heavy salty meals. Manage stress. Move during the flight. Listen to your body. Flying should not feel like a gamble. With the right knowledge, it becomes a routine experience. And the goal of health aviation is to replace fear with understanding. So, if this video helped you, like it so many people can see it. Subscribe to Health Aviation for simple, science-based explanations about flying and health. And tell me in the comments section, have you ever flown with high blood pressure? What was your experience? Until next time, fly informed, fly calm, and take care of your health.